Hello, everyone. My name is Garland Gibbs Jr. I'm going to be presenting my critically appraised topic. So the clinical scenario represents a possible occurrence for a personal trainer. A client would like to lose body fat to positively affect their body composition. Practitioner recommends high-intensity interval training or HIIT as a training modality to lose body fat. To ensure the client that HIIT is a viable modality to lose body fat, the practitioner intends on backing up the claim with current evidence. So the patient or client represents a typical client that a personal trainer will encounter. The intervention is high intensity interval training. The comparison is going to be other training modalities to effect on body adiposity in comparison to HIIT. And then the outcome is changes in body composition. So, and then the clinical question would be for the general population, is HIIT a viable training modality to lose body fat, and how does HIIT affect body composition? I utilized the PubMed database for my research. I first broadly researched HIIT and body composition, which resulted in 230 results. I narrowed the results down by limiting it only to systematic reviews, meta-analysis, randomized control trials, and then limiting the searches from the search to studies from 2016 to 2021, which resulted in 22 results. Then limiting it even more to 3 studies, I used inclusion and exclusion criteria listed here. The inclusion criteria I've already previously mentioned. The exclusion criteria were studies that focused on a specific population, studies that did not discuss the effect of training on body composition, studies that were before the year 2016, and then studies that did not analyze HIIT as a training modality. 3 studies were utilized for the CAT, 2 randomized control trials, and 1 systematic review. This is the first randomized control trial. 20 untrained women were utilized around the age of 25 with BMI greater than 19.1, but less than 34.9. They all had their anthropometric measurements taken via BMI, waist circumference, and skin fold calipers. The procedure was explained, consent forms were signed. The participants were then split up into long HIIT and short HIIT groups. And then within the course of 6 weeks, they trained for 18 sessions with 3 training sessions occurring each week. Measurements were then taken for heart rate, heart power, food intake, and then the anthropometric measurements already listed. The outcome measures were aerobic power via cycle ergometer, food intake via food diary named Food Secret, hunger was measured via VAS, applied after exercise, and then body composition measurements were also taken. After 6-week intervention, there was a significant reduction in fat mass. This study found that there was also a reduction in waist circumference as well, but there is no direct difference in hunger perception. The applicability and internal validity threats were appraised here. Evaluators were not blinded during the study. To address possible bias within the study, blinding the evaluators could have been beneficial. Nutritional information was also provided, which could be an applicability threat, as personal trainers that would be out of their scope of practice to provide nutritional information. The next study listed is a systematic review by Steele et al. This study was carried out by, the searching of the studies were carried out by 2 separate researchers, which yielded 2,085 studies. They then screened to limit the results to 54. Inclusion criteria would be having the correct training protocol and then sufficient data. They used PubMed, Scopus, CINAHL, Sport RXIV. All these databases were utilized using search terms such as interval training, intermittent training, or HIIT. And then 2 authors independently evaluated each study, evaluating for reliability and validity. The studies were measured on methodological quality via the PADRO scale. 32 studies were considered excellent, 21 studies were rated as being good quality, 1 study was rated as being fair. The results of the systematic review was that it did not support the superiority of HIIT compared to moderate intensity continuous training, and both training protocols produced small reductions in fat mass. The systematic review is the highest level of evidence, so this would be my best evidence. Nutrition highlighted was highlighted once again. So that would be outside of the personal trainer scope of practice, and then studies not in English were excluded. So to account for internal validity, they should include studies that are not in English. The last study utilized for the critically appraised topic was this randomized control trial by Ramirez, Velez et al. It utilized 55 sedentary subjects with a mixture of women and men. The subjects were from 30 to 50. They were all considered sedentary, and they took waist circumference measurements to measure body composition as well as their BMIs. They were then split up into groups: a non-exercise group, a HIIT group, a resistance training group, and then a combination of HIIT and resistance training. Nutritional information was then processed, and they were given individualized nutrition plans. Over a 12-week period, they trained, and they measured the loss in body weight primarily, but they also measured fat mass as well as local fat mass, and then gains in lean mass. The result was that HIIT, resistance training, and circuit training all showed decreases in several fat markers, with HIIT having the most effective regimen. And then some internal validity and applicability threats was only one site conducted the study. So to account for bias, more sites could have conducted the study, or multiple sites could have conducted the study. The study utilized a customized nutritional plan, once again, out of the personal trainer's scope of practice. And then the trial was only 12 weeks. So they could have had a longer study, which could have shown the long-term benefits of HIIT. So for a summary, each study used similar methods with different measurements. Each study's quality differed in regards to applicability and validity. Like I said previously, the systematic review was probably the most valid research I had, because it's a systematic review, which is a higher degree of evidence. And then all studies indicated HIIT affected body composition either slightly or significantly. And then nutrition was a major factor in terms of body composition. The clinical bottom line. So HIIT can be utilized to positively change body composition. However, you could utilize different training modalities to change your body composition. You could utilize resistance training or circuit training. It's going to be dependent on the individual if that training modality is optimal. Nutrition and being in a caloric deficit is definitely the most important variable for fat loss. And then further research is going to be needed to detail the effects of HIIT on body adiposity. And then here are my references. Thank you very much.